So for this question, this was how the question was asked in an exam. It said that a 2-year-old was presented to what, or rushed to the what, emergency pediatric unit, that's the EPU. Now the child had a 5 days history of fever and had a few hours of what, loss of consciousness. The loss of consciousness was not for long, just a few hours back, but the fever has been there for 5 days. And for African parents, they won't bring the child to the hospital. Is when the eye don't red, now they will bring the child. So they said that you should list 5 important questions that you ask the patient, the parent, about this child, so that it can make you suspect some things, right? You should also list 5 important signs you look out for when you are doing a physical examination on this child. You should state 5 differential diagnoses. You should state 5 important investigations. Then from your differential diagnosis, that's the possible conditions that could be wrong with this child, you should discuss the management for the most likely one that you are suspecting at this one. You understand? So 5 important questions you ask for history is, for the fever, you're trying to look at how long has this fever been there, and also look at the pattern of fever. Has the fever been consistent, or the fever is coming and going? That means a continuous fever or intermittent fever. You look at the history of seizures, okay? You look at vomiting, is it projectile? You are looking at recent illnesses or exposure. Are they coughing? Is there diarrhea? Sick contacts, mosquito exposure. You're not only looking at one side, right? You're trying to ask all around, okay, because anything can happen. They're also looking at the immunization status of the child. Like, have the child been taking their immunization, pneumococcal conjugate vaccines, measles vaccine, polio vaccine, hepatitis. What the is this? Okay, hepatitis B virus vaccines and everything. Okay, so I was also trying to ask questions around trauma. Have they ingested any poisons, toxins? Blah blah blah. Then, most importantly, ask the parents, which drug have they given? Because most of the times they go to the pharmacy, is when they see that things are getting red, that's when they always come to the hospital. So 5 signs to look out for is the glass coma scale, signs of meningeal irritation like neck stiffness and bulging fontanelles, that's increased intracranial pressure, right? The signs of raised intracranial pressure, right? Like bradycardia, irregular breathing, papilledema. Then for the vital signs, you check out for the vital signs. You check out for signs of dehydration, like is there dry mucus? You ask them to open their mouth to see if their mouth is dry, if the tongue is dry. They do the skin tool, so you draw their skin like this and see if it takes some time before the skin comes back. All those things, okay? Then other signs, you look out if they have rashes on the skin. You check out for the spleen and the liver if it is enlarged. So 5 differential diagnoses. We have the cerebral malaria, we have acute bacterial meningitis, we have febrile seizures, we have sepsis with encephalopathy. Why are they always talking about the brain? They're always talking about the brain here because loss of consciousness have to do with the brain, you understand? So you also have viral encephalitis, okay, that's inflammation of the brain tissues because of viral infections. So 5 important investigations you do. The random blood sugar, because the child might be weak, so you want to confirm that they have low glucose. Malaria test, because you are suspecting for cerebral malaria. Okay, lumbar puncture, full blood count, electrolytes, urea and creatinine. Okay, they just said only 5, but let me add more for you. You can choose. Chest x-rays, CT scan of the brain, blood cultures. You understand? So let me tell you something. One key about discussing disease conditions in whichever country you find yourself. When you list differential diagnosis, the staff or your lecturer is always looking forward for you to suspect a common disease in the environment. So as for me, like this, I'm in Africa, I'm in Nigeria, I shouldn't be suspecting some white man type of disease condition for a child in Nigeria. I should be suspecting for malaria complications. Very common. Do you understand? So the most likely diagnosis, like for our setting, we're in Nigeria, so cerebral malaria is the most likely diagnosis. Okay. So first of all, you have to make sure that the child is breathing, their airways is nice, they are breathing high flow oxygen. You put them on oxygen masks, make sure that the circulation is cool, everything. Check the blood glucose. If they are hypoglycemic, you give the 10% dextrose. Okay. So specific management. The child is unconscious, they have lost consciousness. Now see, you can't start saying you want to give oral drugs. A child that is not conscious, how can they swallow? So it's intravenous. You have to put the drug through the vein because the child is unconscious. So intravenous artesunate. Okay. If there's bacterial meningitis, you can give antibiotics. So in Nigeria, you can be suspecting next for meningitis. Then also ceftriaxone or cefotaxime. That's for meningitis. But I'll actually advise you to just discuss only cerebral malaria, please. Okay. Then for the seizures that the child was having, you use the benzodiazepines type of drugs. That's drugs like diazepam, midazolam. So if they're having fever, use paracetamol. If they are dehydrated, you hydrate. With intravenous and normal saline. If they have anemia, I keep monitoring that. You keep monitoring how their kidneys is functioning. Keep monitoring the electrolyte imbalance. And with this, we have actually made a lot of justice on this. Okay. Whew. So this is the 70th question, and I'm done. Right. So I'll be seeing you guys. I'm supposed to start answering questions on obstetrics and gynecology. That's pregnant women issues and girls issues. But that will be tomorrow. For now, I'll just dress up and go to the school. I'm supposed to be at the school library. I have exams on Monday and Tuesday. So I have to go and read. Okay? I'm not a terminator type shit. Girl, I'm actually eating.